Good afternoon, Long Beach. Today is our briefing for Monday, June 15th, 2020. And as a reminder, we are now doing our community and press briefings twice a week. So that'll be Mondays and Thursdays at 3 p.m. As some of you already know, because you visit our online dashboard, we have over 2,600 residents who have tested positive for COVID in Long Beach, and a little over 2,000 of them have recovered. We have a total of 114 of our residents who have passed to COVID, and as we know, reporting isn't happening on Monday for Sunday, and so tomorrow's report will have a combined two-day report as far as any passings that we've had, and so our thoughts go out to all of them. And 88 of the fatalities of the 118 have been from long-term care facilities. I want to just start with a brief announcement, and then we're going to get to some COVID information. Last Tuesday, the Long Beach City Council unanimously approved our city's framework for reconciliation in Long Beach, and that framework has really come out of the conversations, the demonstrations, the protests that have happened not just Long Beach but really across the country. And our framework in Long Beach, it was unanimously adopted by the City Council, is really looking at change to address systemic racism, racial injustices, and ensuring equity for everyone in our community. We know this is a very difficult time as it relates to equity across the country. We have to acknowledge that we have a long way to go locally, but also as a nation. And so within our framework that really begins this week, there are 4 key steps. The first is acknowledging the existence and longstanding impacts of systemic racism here in Long Beach and in our country. We have done that. We continue to do so. The second is to listen to accounts and experiences of racial injustice, inequity, or harm to community members. That listening process is actually starting this week through a formal process through the staff. I personally have also been meeting with different groups of folks. I met with some young, youth of color and that were within our high schools and our middle schools and spoke with them. I've talked to some Black educators and scholars from Long Beach, and I will continue to do that as well. But the listening is really important. That's something we've heard often from the community. Then also we'll be convening stakeholders to evaluate the feedback from the listening process and shape policy, our budget, our charter, and any programmatic ideas to reform that we might have. And then, of course, we're going to be taking action, which is where our city management team will be presenting immediate short-term and longer-term recommendations for the City Council. And so all of that and that framework was adopted last week, and now the listening sessions begin this week. We encourage folks that want more information to please visit. If you go to the Long Beach Health Department's website, and you go to the Office of Equity link, in the Office of Equity link, which is the office leading this work for us, you will find a lot of information on how the reconciliation framework works, how to get involved, how to attend and be a part of one of these listening sessions, and how you can also directly get involved in this work. If you have any questions or ideas, you can also email us at equitylb@longbeach.gov. That's equitylb@longbeach.gov. We have a real diverse team of city leadership and staff that are leading this effort, and so I want to thank them, and we're looking forward to this process as it begins. But I also want to turn to COVID-19. And as we talk about racial injustice, we know that COVID-19 as a health crisis has especially impacted the Black community. Black residents make up 13% of the population, yet account for 23% of our COVID deaths here. Black residents are also hospitalized for asthma 9.4 times more than others. And we know that there are not just racial disparities within all systems, but especially within health as well, which is why these conversations are so important. And as we speak about COVID, I wanted to talk about what Long Beach is doing as we move forward. The first is, as a reminder, there's been a series of studies that have come out recently, and Dr. Davis and others will tell you that wearing face coverings and masks is more important than ever. As more and more of the economy opens up, you should be always wearing a face covering or mask when you're leaving your home, when you're interacting with other people, and certainly when you're going into a business, it is required. We know there are obviously some exemptions if you were at a restaurant, but overall, people should be wearing face coverings. It really is the safest way to stop this disease that is still very serious. And as it relates to COVID, we have a couple of announcements from the city perspective. I want to first update you that at our public library system, we are launching a curbside pickup for materials and books starting on June 23rd. And we're launching a library virtual version of our summer reading program as well. We know that libraries are a really important place for people and families. It's hard to not have them open right now. We're coming up working with plans on how to reopen our library safely, but we want folks to be able to also get books and have curbside pickup. And our librarians, we want to make sure that they're safe, and our workers in our libraries as well. So you can learn more about these programs at lbpl.org. And now I want to also talk about day camps and our summer programming for the city. This is difficult news because we know that our summer programming is a really important part of what happens every summer in Long Beach. We have great programs. Our 100 Days of Summer programming includes concerts and festivals and gatherings for families. And because of this health pandemic, which is still occurring and still real in our city and the state, we are having to dramatically eliminate and reduce much of our summer programming. As of today, the state will not and does not allow gatherings of individuals unless it is specified in the guidelines. And so any type of gatherings where you're having groups of people are currently not allowed by the state. And so because of that, we are not able to put together some of the programming that we would normally have during the summer. This includes activities like our Movies in the Park program, our park concerts, and other types of festivals that happen during the summer. We'd love to be able to do these in a way that was safe for everyone. They're just not allowed by the state of California. And because they're not allowed anywhere in the state, in any county, including Los Angeles County, we cannot do them. These programs would typically be starting in the next week. You'd start seeing some of this programming as school got out. And so those are unfortunately not happening this year. However, there is some good news of what we're doing. So while our traditional Parks and Rec programming will not continue in the way it always has, and the summer programming that we put out over the summer, we are consolidating a lot of those programmings and activities that we have into some new day camps that the city will be sponsoring. These day camps are going to be available all across the city. And these day camps will be opportunities for parents to be able to leave their kids, their youth, with trained facilitators and park and recreation leaders in the city, to have exercise programs, to have programs to reduce any sort of mental health issues, and really to help the emotional and well-being of the full child. There will be opportunities at many of our parks across the city for these day camps. These types of camps typically for a parent could cost over $100, $125 in Long Beach, even just last year. We're going to be offering these camps for as little as $30 to $35 a week. And for an extended camp for a week, it could be around $50 a week. The city's putting out information on the details of these camp programs later today. But just to give you some examples, these day camps will be opportunities for parents to leave their kids really for childcare, for child supervision, so that parents can go to work and do the other functions they need to over the summer. The camps will have strict guidelines on the number of children that can participate. They will have physical distancing requirements. There'll be sanitation measures put in place, and interactions will be limited within the camps to make sure the kids stay safe. For 5 to 12-year-olds, we'll have programs at 22 sites across the city. And some of these sites include Admiral Kidd Park, Bayshore, Bixby Park, Cesar Chavez, the Colorado Lagoon, Coolidge, Drake Park, El Dorado, Houghton, MLK, McBride, Orizaba, Pan Am Park, Ramona, Seaside Park, Schwer Park, Silverado, Somerset, Stearns, Veterans, Waterloo Park, and Whaley Park. For our older kids that are aged between 13 and 18 years old, we'll have these types of day camp programs at 4 park sites, including the Freeman Community Center, Houghton Park, McBride Park, and Silverado. And in addition, we will be launching our summer food program at 30 sites across the city. Most of the parks that have already been listed, but also some additional parks. This is a free food program so that kids can get nutritious meals during the summer. And all this information will be available on our Parks and Recreation website. Some more announcements. We've worked hard to ensure that our Long Beach Junior Lifeguard Program can continue this summer, and it will be able to with modifications that aligned with our health orders and state guidance. Staggered times will be required, and there will also be 2 sessions a day that will run from July 6th through August 14th for our Junior Lifeguard Program. As always, please visit LongBeach.gov for juniorguards.com, and that gives a lot more information about the Junior Lifeguard Program. So it will be different this year because of COVID, but we're still going to have that program as well. We know there's a lot of other activities over the summer that people enjoy. We have not yet opened yet. We're working on it. We know there are swimming pools at Belmont, Silverado, King are not yet open. We're working on plans for those. Our nature center classes that happen over the summer are not happening. Youth and adult sports programs are not yet allowed by the state, so we don't have that programming. And as far as youth sports go, we are working closely with the organizations that typically get permits for these activities. And obviously we have groups like AYSO and Little League, Pony and others. These activities are just not yet permitted by the state of California. And we've been given no indication as to when they will be allowed. And so as of now, they are not allowed in Long Beach. If they're at some point, there's changes at the state level to allow these types of activities in a way that is safe. Long Beach will have to work directly with these organizations to see if the timing even works, because many of these, as you know, organizations, it takes organization to put them in place and time. And so we know that that clock is ticking away. And let me finally say that you can get all this information at the LongBeach.gov /park and recreation website, which is LongBeach.gov / I believe it's parks. Is that right? The park website. And just Parks and Rec on the city website. You'll be able to get all this information. So again, we know that a lot of the summer programming would normally have is just not allowed by the state of California, and so we were modifying what is allowed by the state of California are day camps for youth, and so we're consolidating all of our summer programming into these day camps for young people across the city. We hope that will help parents this summer. And as soon as we hear about the more organized sports from the state, if it is even allowed this summer, we will do those as well. And so with that, I want to, again, just remind folks that these decisions are hard ones, but they are to keep our community safe. People are dying every single day still in Long Beach because of COVID-19, and we got to stay serious and ensure that we keep people safe. With that, I'm going to turn this over to Dr. Davis, who has additional updates. Thank you.
Thank you, Mayor. Good afternoon. As our city continues reopening, I want to remind everyone that there's no way to ensure zero risk of infection. We're still all safer at home. The risks of widespread community transmission are still a very real threat to the health and safety of our community here in Long Beach. Taking precautions seriously is especially important if you or someone you live with is at high risk for severe illness from COVID-19, including anyone 65 years and older and those with chronic underlying health conditions. it's still recommended that these individuals stay home as much as possible to avoid unnecessary exposures or being around other people who have COVID-19 and could be contagious. Of course, if you have COVID-19 or you have symptoms that could be COVID-19, or you've been in close contact with someone who has COVID-19, you must still self-isolate or self-quarantine at home. For everyone else, it's important to consider the risks and continue to implement various prevention measures to protect yourself and reduce the spread of COVID-19. So it's like driving or riding in a car. There's risks involved every time that you ride or drive in a car, but the seat belts, airbags, rear view cameras, and other safety precautions lessen those risks. But nothing, except not getting in the car, brings your risk to zero. So that's what's similar to COVID-19, and so we're going to go over what the seat belts and airbags are for COVID-19 to lessen your risk. So the first thing is to consider how many people you'll be interacting with, for how long, and for how close together you're going to be to those other people. So it's a numbers game. The more people you interact with, the longer your interaction with them, and the closer, the more proximal you are to these other people, all increase your risk, give you a higher risk of becoming infected. So your precautions are basically to interact with fewer people for shorter periods at longer distances away from you. So engaging with people that you don't live with increases your risk. And also interacting with people, with a great number of people, increases your risk. And be sure to keep in mind that even if you're not showing symptoms, you could still be contagious. Make sure that you maintain at least 6 feet of space between you and others. So that's the proximity seatbelt. The closer you are to other people who may be infected, the greater your risk of becoming infected or infecting them. So the farther you are, the better. The shorter amount of time, the better. So if you can limit your interactions, if possible, to 10 or 15 minutes with other people who aren't in your household, that lessens your risk than if you had a longer interaction with people that close by you. If you can keep 6 feet, then you can have a longer interaction. But if they're getting close to you, then you want to try to keep the interaction as short as possible. And then when you are having an interaction within 6 feet, make sure that you wear a face covering anytime you can't maintain that 6 feet. Wearing a face covering doesn't eliminate the risk of contracting the virus, but it does minimize the spread of potentially infectious particles that you're expelling when you speak, cough, or sneeze. And remember that you wearing a face mask is protecting others, and other people wearing a face mask around you is protecting you. So it's important that both people who are interacting are wearing their face masks. Also, it's thought that staying outdoors, if you are interacting with people, interacting outdoors is better than interacting indoors. When you're outside, it allows you to maintain more distance between yourself and another person. And it also, the wind disperses the particles more quickly. And finally, just as a reminder, as the mayor said, right now, all gatherings, regardless of size, consisting of individuals from multiple households, are still prohibited under the Safer at Home order. And remember to always wash your hands and disinfect high-touch surfaces frequently. So now I want to move on to a syndrome called the multi-system inflammatory syndrome in children. Right now, children under 18 years of age make up less than 5% of all positive COVID-19 cases in Long Beach. But there is evidence of a complication that seems to be affecting some children. And this syndrome is called the multi-system inflammatory syndrome in children, MISC or MISC for short. and it's a condition in children that may be associated with COVID-19 infection. While we don't have any confirmed cases of MISC in Long Beach, I wanted to make people aware of this rare but serious condition that's been observed in children elsewhere in the nation and in the world. So multi-system inflammatory syndrome in children is a condition where different body parts can become inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. We do not yet know what causes MISC. However, we know that many children with MISC had the virus that causes COVID-19 or have been around someone else with COVID-19. While MISC is rare, it can be serious and even deadly. But most children who are diagnosed with this condition have improved with medical care. Common symptoms of this syndrome include irritability or sluggishness, stomach pain without any other explanation, diarrhea, vomiting, rash, conjunctivitis, which is red or pink eyes, enlarged lymph nodes on the neck. There'll be kind of big bumps that you'll feel, red cracked lips, or a red tongue that looks like a strawberry. Swollen hands and feet, which may also be red. And just to note that not all children have all of these symptoms or all the same symptoms. Call your child's doctor if your child has a persistent fever plus any of the above symptoms. The doctor will ask about the symptoms your child has and use that information to determine next steps. If your child is severely ill, go to the nearest emergency room or call 911 immediately. Make sure to wear a face covering before entering. Doctors may do certain tests to look for inflammation or other signs of disease. These tests might include blood tests, a chest x-ray, a heart ultrasound, otherwise known as an echocardiogram, and an abdominal ultrasound. Doctors may provide supportive care for symptoms, such as medicine or fluids to help your child feel better, and may use various medicines to treat inflammation. Most children who become ill with MISC will need to be treated in the hospital. Some will need to be treated in the pediatric intensive care unit. MISC is not contagious, but it is possible that MISC is associated with COVID-19 or another infection that may be contagious. Hospitals will take infection control measures when treating your child. Public health officials are still learning about MISC and how it affects children. We still don't know why some children have gotten sick with MISC and others haven't. We also do not know if children with certain health conditions are more likely to get MISC. These are among the many questions that health officials are trying to understand and working towards. So in closing, for more information about COVID-19, please remember to visit our website at www.LongBeach.gov/COVID-19 or contact our info line 562-570-4636. Thank you.
Are there any questions, Kevin?
Yes, Mayor. We have a few questions from the media. The first question is from Kelly at the Long Beach Post. This question is for Dr. Davis. It's been 2 weeks since the mass protest in Long Beach. Have we seen any case increase attributed to this? And can the city talk about steps it is taking to determine if protest gatherings are impacting case numbers?
Mm-hmm. Thank you. Thank you for that question. We have not seen a spike at this point that we could attribute to the protests. It will take some time. There's about, the incubation period can be 2 to 14 days, so that's how long it can take for you to develop symptoms. And so you have to wait that time period and then be tested, and then the turnaround time for the test, and then we have to contact you. We are asking people if they've, when we interview them, if they've been to a protest. We have had some people who have said yes. However, just them saying that doesn't necessarily mean that that's the reason or where the exposure happened, where they came into contact with someone else with the virus who was contagious. Because it's transmitting and circulating within our community, it could be that they got it from somewhere else. I don't know if I remember all the parts of that question. So we continue to, we're watching our cases every day. And the problem or the issue, the challenge is going to be figuring out, because there's so many things that we're changing, being able to isolate each variable and say that's the reason why cases are going up is going to be difficult, because we also had Mother's Day, we started reopening at that time, we had Memorial Day, which anecdotally there seemed to be more celebrations around Memorial Day, and we've continued to reopen, and so it'll be difficult to parse out what's causing increases, which we do expect to see because we are opening our economy and people are able to interact more.
All right. Thank you, Dr. Davis. Next question comes from Rachel Jordan from ABC. Rachel, go ahead.
Thanks. So this question is for the mayor. I've seen on social media a lot of people are complaining that they're noticing more and more people not wearing masks in Long Beach. And now, as we know, Orange County is no longer requiring masks. So are there any plans to begin requiring and not just recommending masks whenever leaving the house in Long Beach, similar to Mayor Garcetti's order from last month?
So I think first, people should be wearing face masks and face coverings. And actually, Long Beach does require that you wear a face covering or face mask when you are entering a retail business or an establishment, or whether you are around others. So that actually is a requirement in Long Beach. There's a lot of individuals that are choosing to not do so. We understand that. It is irresponsible. In my opinion, it's also not supportive of our most vulnerable people in our community. We know that folks that are asymptomatic can transfer COVID to your parents, your grandparents, someone's grandparents that are vulnerable, and can cause death and great sickness. So we wish folks would be more responsible. I will tell you that it really depends on the day. I will be out one day driving, and I'll see most folks out with face coverings or face masks, and there might be another day where it's less so. So it's just really, I think, dependent. Wear a face covering. It's the best way to protect yourself. If you're going to be out, you're going to go to places, you need to have a face covering. And if you are a business, you are required to ask your customers to have face coverings or masks and when you enter. And it's not just to protect them, it's to protect your workers. And your workers deserve to work in an environment that is safe. So we want to continue. We've been talking, I've been chatting with other folks about strengthening our mask and face covering requirements as more begin to open. I would support that. I think that that's something that's being discussed from a medical professional perspective. Obviously they want to make sure that face coverings are worn, but they shouldn't also be used as an excuse to not physically distance or be safe in other ways. So we'll continue to push that issue.
Thank you, Mayor. Another question from the Long Beach Post. Many people have described restaurants not following public health orders over the weekend. How is the city enforcing this in restaurants?
So, yeah, I think last Friday we may have announced a new phone number and email to report any business, restaurant, or other that is not complying with the health orders. That number is 562-570-2633, and the email is cetaskforce@LongBeach.gov, and I think that stands for Code Enforcement Task Force. So cetaskforce@LongBeach.gov. You can email or call any tips on anyone that's not complying. But also, I do believe this last weekend, the health department had a team of individuals go out to restaurants across the city to look for compliance and to make sure that the compliance was happening. So they did interact and provide education to a variety of restaurants, I believe, and fitness gyms this last weekend. They will be doing the same this upcoming weekend. And to be very honest, it's in the best interest of the restaurant to follow the order and do it safely, because most of the folks that I talk to, when they've gone out to a restaurant and they're feeling like it's unsafe, they're walking right back out or they're not coming back. And so I think from a business perspective, it makes sense to follow and be as safe as possible in those establishments. Tied into that point, tomorrow night the council is voting on a bunch of new open streets and kind of parklet programs in the city to assist more restaurants. So I think that's happening tomorrow night as well. So we'll continue to do that work. But they'll be out again this weekend.
Thank you, Mayor. We now have a couple of questions from social media. Why are we reopening?
Dr. Davis, or for me?
It could be for you. Why are we reopening more businesses and activities when cases and deaths are rising?
So the city is following the kind of state guidelines as far as the timeline as to what to reopen and when. Long Beach and the county have actually moved slower in this last round than the rest of the state. There are some activities that Dr. Davis and the county health officers feel as are still too high risk to reopen at this time. And so, we're not where many other communities are. So I think that our team is being more cautious in the reopenings. I think, obviously other places have bars or family centers that have reopened. That has not happened in Long Beach or the rest of the county. There's a variety of other industries that may open on Friday in other parts of the state. The city may or may not reopen those other industries depending on what the data looks like this week. And so I think that the city has been much more cautious and slow in those reopenings and will continue to do so, and we should not rush. But it is concerning. I mean, every time we understand, it's from a job and economic perspective, we are moving this economy forward. That's something that, clearly the governor's plan is to slowly reopen the state. I think we're all following that. But we should all be concerned, and which is why wearing face coverings or masks or being cautious is really important. If you're feeling unsafe, please continue to stay home. A lot of us are staying home much of the time, and that's keeping a lot of folks safe.
All right, thank you, Mayor. One last question on social media. Dr. Davis, are churches allowed to be open, and can you talk about that a little?
Yes, so churches are allowed. To get into the details, I would recommend going to the Safer at Home order. If you just Google Long Beach Safer at Home order, I'll say what I remember, but to verify, churches are able to open. All faith-based centers are able to open, mosques, synagogues, churches, what have you. Temples, and with modifications. So that is decreasing the occupancy to either 25% of the occupancy or 100, whichever is less. And all of the types of modifications that go towards, encouraging people who are sick to stay home, encouraging physical distancing, recommending not singing, modifications around things like communion. You also can have worship services outside, and there's a limit on the amount of people that can participate in that way too. But you can have faith-based services in person under the order right now.
All right, thank you, Dr. Davis. That's the last question on social media.
Muy buenas tardes, gracias por acompañarnos hoy. Empezaremos con nuestros números del coronavirus de partir de hoy, 15 de junio. Indica que 2,634 personas han salido positivos al coronavirus. Aproximadamente 2,036 personas se han recuperado. Hemos perdido 114 residentes de Long Beach a causa del coronavirus y 88 de estas muertes han sido asociados con centros de enfermería de largo plazo. Platicamos un poco sobre el marco de la reconciliación. La alcaldía, desde la semana pasada, como les contamos, aprobó una unanimidad de los planes para marco de reconciliación en Long Beach. Esto es sobre el racismo sistémico que existe en todas las instituciones públicas, que incluye también nuestra ciudad y nuestra comunidad. El marco de reconciliación le dará a la ciudad la oportunidad de escuchar a la comunidad que exige cambios y tomar medidas para resolver las injusticias raciales y equidad para todos. Hay cuatro etapas o pasos que son muy claves. Es primeramente reconociendo la existencia y los impactos de larga data del racismo sistémico en Long Beach y en todo el país. Escuchar las experiencias de injusticia racial, inequidad o daño de los miembros de la comunidad. Convocar las partes interesadas para evaluar los comentarios del proceso y de escuchar y dar forma a las ideas de política, presupuestos, estatus y reforma programática. Acción catalizadora, donde la administración de la ciudad presentará recomendaciones inmediatas a corto, mediano o largo plazo para consideración de nuestra alcaldía. A partir de este jueves y hasta julio, los residentes de Long Beach tendrán la oportunidad para participar en una serie de sesiones de colaboración para escuchar en la comunidad al estilo como un grupo pequeños, de grupos focales. Podrá participar y proporcionar ideas para crear un cambio significativo para todos los aspectos de la inequidad y la injusticia racial. Por ahora, de acuerdo con nuestras órdenes de salud y medidas de distanciamiento físico, las sesiones de escucha tendrán y se estarán dando no en persona, sino que virtualmente. Esta retroalimentación ayudará a dar forma a las ideas de política, presupuestos y reforma para consideración de la alcaldía para implementar la reforma estructural en julio y agosto de este año. En Long Beach, la pandemia del coronavirus ha impactado especialmente a la comunidad negra. Los residentes negros representan el 13% de la población en la ciudad, pero representan el 23% de las muertes justo dado del coronavirus. Los residentes negros también son hospitalizados por asma 9.4 veces más que los residentes blancos. Eliminar las desigualdades raciales en los ingresos y la riqueza beneficiará a las familias, las comunidades y la economía local y regional. Long Beach es una de las ciudades más diversas del país y estamos orgullosos de eso. Ahora debemos trabajar más duro para asegurarnos de todos que nuestra ciudad tenga la oportunidad de prosperar. Algunos datos sobre nuestra biblioteca en la ciudad, en nuestra comunidad. Sabemos que nuestra biblioteca es un recurso importante en nuestra ciudad para proporcionar todo desde libros, películas y hasta estudios de idiomas y recursos profesionales. Aunque las bibliotecas permanecen cerradas al público, 4 ubicaciones proporcionarán la recogida de sus libros y pedidos afuera de la biblioteca a partir de la próxima semana, el 23 de junio. La biblioteca también está lanzando una versión virtual de su programa de lectura del verano. El programa de lectura de verano es una forma divertida para los niños y jóvenes para que se mantengan en más todavía leyendo y sus lecturas. Es muy importante que sigan estudiando y contra la pérdida de aprendizaje durante el verano. Hay más información disponible en nuestro sitio de web de la librería en la ciudad de Long Beach. También algunos datos sobre nuestros parques. Sabemos que no todos los servicios recreativos están abiertos todavía, pero queremos avisarles que los parques se han convertido en una parte crítica de la reapertura de la comunidad y la economía de Long Beach. Muchos de los servicios de los parques unirán para proveer campamentos de día para la comunidad, especialmente para los niños y los jóvenes. Áreas saludables, los parques crean áreas saludables en el aire libre para hacer ejercicio, mejoran su salud mental, especialmente ahorita en estos momentos puede reducir el estrés y claramente mejora el bienestar psicológico, emocional y físico, especialmente para los niños y toda la familia. Vamos a abrir ciertos parques en la ciudad. Para los niños de 5 a 12 años tendremos programas en 22 de esos sitios. Para los niños de 13 a 18 años tendremos programas en 4 de esos sitios y adicionalmente tenemos un programa de alimentación del verano que se ofrece en 30 de los parques y sitios alrededor de la comunidad. Puede encontrar más información en nuestro sitio de web de Parks and Recs. Y también queremos compartir algunas cosas que todavía no se han abierto. Son las piscinas de Belmont Shore, de Silverado, de King Park y también el Centro de Naturaleza, Museo y Clases. Programas deportivos para jóvenes y adultos. Todavía tampoco no se han reabierto. Esa es la manera que tenemos que ver que las organizaciones de fútbol, de béisbol, tienen que todavía tener más reuniones para decidir si es que sí vamos a reabrir y tener esos programas este verano. Si nomás tomen esas decisiones, tendremos más información para ustedes. También estamos trabajando estrechamente en colaboración con organizaciones y titulares de las compañías, de los programas como Pony, Little League del béisbol y AYSO también. Ahora algunos datos de nuestras actividades personales y sociales que nos dio esta tarde la doctora Davis, la directora del Departamento de Salud, que a medida que nuestra ciudad continúa reabriendo, queremos recordarles a todos que no hay forma de garantizar un riesgo de cero infección. Todos estamos aún más seguros en casa. Queremos recomendarles que se queden en casa lo más posible. Los riesgos de una transmisión comunitaria generalizada siguen siendo una amenaza muy real para la salud y la seguridad de nuestra comunidad. Tomar precauciones con seriedad es especialmente importante si usted o alguien con quien vive tiene un alto riesgo, como las personas mayores de 65 años o más, o cualquier persona que tenga otros problemas de salud crónicas. Todavía se recomienda que estas personas se queden en casa, especialmente para evitar exposiciones innecesarias. Si tienes al coronavirus o síntomas del coronavirus, ha estado en contacto con alguien que ha salido positivo, es mejor ponerse en cuarentena en su hogar, alejado de otros familiares y amistades. Definitivamente esto todavía es un juego de números. Entre cuantas más personas interactúen y más tiempo dure su interacción, mayor será el riesgo de infectarse o infectar a otros del coronavirus. Seguimos recomendando. Sabemos que salió una pregunta sobre esto hace momentos. Sabemos que otros condados se ha visto menos personas usando las coberturas. Algunos días vemos que más personas las usan, a otros días menos, pero es muy importante. Aquí en Long Beach, en nuestra ciudad en Long Beach, requeremos que se usen las coberturas para la cara, especialmente cuando sale a los lugares a hacer compras, a recoger comida, cualquier lugar. Y los negocios, es muy importante que los dueños de estos negocios protejan al público y protejan a sus empleados también. Finalmente, las reuniones, independientemente del tamaño, que consisten en individuos de varios hogares, aunque están prohibidas bajo la orden actual más seguro en el hogar, algunos estudios sugieren que el coronavirus no se propaga tan bien afuera. Permanecer al aire libre puede permitirle mantener más espacio a los demás. También puede dispersar gérmenes más fácilmente en comparación con las reuniones interiores que tienen menos ventilación. Por último, recordarles que se laven las manos, desinfectar las superficies de alto contacto con frecuencia. También hemos tenido alguna información sobre un síndrome inflamatorio multisistémico que se ha visto recientemente en los niños. En este momento, los niños menores de 18 años representan menos del 5% de todos los casos positivos del coronavirus en Long Beach. Sin embargo, existe evidencia de una complicación que parece estar afectando a algunos niños. El síndrome inflamatorio multisistémico, o como lo voy a mencionar, MISC, no tenemos ningún caso confirmado todavía en nuestra ciudad. Esta enfermedad y otras afecciones inflamatorias graves, como la enfermedad de Kawasaki y el síndrome de shock tóxico, es una condición rara. Sin embargo, debido a que está potencialmente mortal, es importante que los padres sepan los síntomas y conozcan algunos de los signos para que puedan obtener ayuda inmediato. Algunos de esos síntomas comunes incluyen irritabilidad o lentitud, dolor abdominal sin otra explicación, cosas como diarrea, vómito, erupción, cuando se le ponen los ojos rojos o rosados a los niños, ganglio linfático agrandado al lado del cuello, labios rojos o lengua roja que parece como se hincha y parece como una fresa, manos y pies hinchados que también pueden estar rojos. No todos los niños agarran estos síntomas. So es muy importante ponerle atención si su hijo siente que su hijo puede tener algunos de estos síntomas mencionados. Por favor, llame a su médico inmediatamente. Y si hay alguna fiebre persistente, es mejor llamar al hospital o que llame al 911 o que vaya al hospital. Pero recuerde que tiene que usar su cobertura para la cara. Las coberturas y las higiene de las manos, el distanciamiento físico es muy importante. Por favor, sigan practicando eso. Los niños con afecciones médicas subsiguientes pueden tener un mayor riesgo de malos resultados del coronavirus, lo que hace las medidas de prevención que sean más importantes. Todavía hay mucha ciencia que estudiar sobre esta enfermedad y los profesionales de salud pública, junto a los médicos, todavía siguen investigando esta enfermedad también. Si necesita más información sobre el coronavirus, recuerde visitar nuestro sitio de web a www.LongBeach.gov/COVID-19 o también puede llamarnos a nuestra línea de información del teléfono. Muchas gracias por acompañarnos esta tarde. Tengan buen día. That is all the information we have for you today. Thank you, and we'll be back on Thursday.